Hi everyone, Dr. Emmy from Pain Free and Fit. Today, a great exercise for those of you with shoulder pain during overhead presses. We're going to be discussing a band exercise to help activate and strengthen your rotator cuff muscles, properly holding your shoulder joint in its place to help remove that shoulder pain. Hope you enjoy. So there are many reasons for overhead pressing shoulder pain, including impingement, which is a compression of the rotator cuff tendons, the bursa, and other soft tissues in that area as the arm comes overhead. There's several reasons for this. We're not going to cover these in our video today, but among the most common reasons are protracted or rounded shoulders while shoulder pressing, problems where the scapula or shoulder blade doesn't turn outwards as you're moving up, but you keep your shoulder blade still and disallow it to rotate, so therefore the arm bone has more impingement as it travels overhead. Also, a pronated grip where your palms are forward. Many times that causes internal rotation of your upper arm, which leads to impingement. That's why many people find parallel grip or supinated grips easier with overhead pressing. But today we're going to be talking about the superior migration of the upper arm in the socket. And what that is normally the rotator cuff, when functioning properly, should pull the top of your arm bone downward slightly to keep it centered in the shoulder socket as it's moving overhead. Unfortunately, what happens many times is due to rotator cuff weakness and incoordination that as the arm moves up, the actual arm bone slides upwards in the socket, and that upwards migration helps to pinch those rotator cuff tendons of bursa. So to learn how to correct this common problem, let's begin with one arm overhead, palm facing the head. In this position, to learn how to activate the cuff properly, we're going to first push our shoulder blade down towards our hip as far as we can. That's to make sure that we're not using this motion with this exercise. We want to make sure it's purely in the shoulder joint and not simply moving your shoulder blade down. So this first scapular correction is the opposite of a shrug. If you think of a shrug as moving shoulder blade up, this is shoulder blade down as far as you can. Now, as you hold that shoulder blade down, put a finger on the top of your shoulder, and you'll notice that if you pull the arm bone under your finger downwards, there's a slight movement away from your finger. It's perhaps a 1/16 to an 1/8 of an inch. Get used to holding it down for several seconds, including up to a minute. That way you'll be able to hold this during a long endurance set. And after you get used to this after a few days or a week or two, then you'll be ready to grab a band and a barbell or dumbbell and perform the following exercise. So to begin this exercise, affix a looped band overhead. You're going to take that and put it right around the undersurface of your armpit. That's going to provide you with some pull of your upper arm upwards, which is the exact direction we were talking about correcting. So what you're going to be doing is you're going to resist the band's effect and your arm motion. I'd suggest starting this with a light bell, maybe a 5 or 10 pound bell, just to get the coordination down before you start putting it into your training. What you're going to do is set your shoulder blade down so that it's not moving upwards. And as the shoulder blade is down, you're then going to use that downwards pressure that you practiced initially with no resistance as you move your dumbbell up. The further you go up, the band wants to pull your arm upwards. You're resisting that. The motion of the bell wants to pull your arm upwards. If the band starts to slip, depending on the type of band you use, a flat band is going to give you more friction, is going to be more stable. If you only have a round band, you can take a finger or two and place it right under your armpit so you're hooking the band in your fingers to help anchor it at that point. And just let your fingers glide along your armpit. So as you're moving up, you're resisting that upwards migration. You're pushing down against the motion of the arm and against the pull of the band. Begin with a neutral grip. See how it feels. You may need to switch to a supinated grip if you're still feeling pain. That may decrease your symptoms. And if you feel good, you can use a pronated grip, and then you know you're ready for bar work if there's no pain. Again, use a light band to begin with, use a light bell to begin with, and progress this over time until you feel you have a nice smooth motion with no pain And you can use this exercise both as an activation, a warm-up exercise with light weight before you do your shoulder presses. You don't need to always do your shoulder presses with a band. Or as you get heavy, you can use the band to give yourself some extra resistance. So plug this exercise into your training program and let me know how you make out with your shoulder pain. Questions or comments, write in. As always, I'll do my best to answer. Subscribe to our channel to get some more great videos on learning how to train pain-free. Give me a thumbs up to help share this valuable information with others. And if you're looking to go deeper into your shoulder complex, learning the muscle imbalances of your rotator cuff and scapular muscles, learning how posture and movement deficiencies affect your shoulder pain, and if you want to learn a program to help self-rehab your shoulder, get it back into training heavy without pain, check out our healing exercise program for shoulder pain available at painfreeandfit.com.